Hi Rosie, I'm going to help you to remove your PPE. I'm going to talk you through the various steps and if I could get you to carry them out. Okay. So first thing I'd like you to do is just to check that there's enough room in your clinical waste bin. Fantastic, great. So the first thing we're going to remove is the apron. Okay, so I'd like you to pull the apron forward to break the neck and the waist strings. I'd like you to roll the apron away from yourself and roll it up and then drop it into the bin. Okay, so if you could do that for me, please. That's lovely. If you pop that in the bin. Great. So what we're now going to do is remove the outer gloves. Okay. So what I'd like you to use is the pinch and pull method. I'd like you to remove them and I'd like you to drop them into the bin, please. Fantastic. So the next thing we're going to remove is the gown. Okay. So I'm going to read you through the steps and then I'll get you to do them, okay? So most important thing is I'd like you to keep your chin up, okay? Try not to look down. Then I'm going to get you to untie the side tie on your gown, which is obviously on the your left-hand side, okay? I'd like you to hold the gown just below your collarbones and cross your arms. And I'd like you to pull away. And you should be able to feel the Velcro under the back, okay? Pull forward and away from your body. Fold and roll the top of the gown away from your body tightly. Then I'd like you to gather it all up as you continue to roll. Pull the gown over the gloves. Then continue to roll it up and then place it into the bin. Okay, so if you could do that for me, that'd be great. Thank you. So tie first. Excellent. Remember to keep your chin up. Okay, excellent. So if you could cross your arms, okay, just there, and then just pull away. Thank you. And then keep it at arm's length and roll it as tightly as you can, up and away. Excellent. Okay, if you place that into the bin. Fantastic. So the next thing we're going to remove is your surgical cap, okay? So I'd like you to keep your chin up, very important. Bend forward at the waist and use both hands to hold the top outer surface of the hat, lift it up and away from your head and drop it into the bin. Okay? That's it. There we come. Away. And then just pop it into the bin. Right, Rosie, what I'm going to do now is I'm going to get you to remove the inner gloves. Okay? So I'd like you to use the pinch pull method again. And once you've removed those gloves, if you could place them in the bin. Okay? Great. It's important you don't ping the gloves off. That's it. Lovely. Excellent. So what I'm going to do now is I'm going to give you some hand sanitizer for you to clean your hands. If I can get you to rub your hands until all the alcohol has dried. Okay? Okay, I'm now going to pass you some new non-sterile gloves. There's one. There's the other one. That's great. Okay, so what we're going to do now is we're going to remove the respirator. So I'm going to talk you through the steps. I'd like you to keep your head up, okay, so your chin doesn't touch your chest. I want you to only undo the bottom two buckles, okay? Now I'm going to get you to close your eyes and reach for the bottom of the harness at the back of your head. Keep your chin in the cup of the mask, and I'd like you to lift the harness over your head and push away from the top edge of the mask so it will fall away from your face. Keep your chin up and just undo the bottom two buckles for me. Okay, when you've done that, if you feel behind for the back of your... That's it, eyes closed, and then lift that over your head and let the mask drop away. Okay. Now I'm going to get you to clean your shoes, Rosie, okay? So I'm going to pass you a Clinell, if I could get you just to wipe your shoes. There we are. Thank you. That's great. So what we're going to do now is I'm going to get you to remove the gloves that you're currently wearing. Use the pinch and pull method again, please. Excellent. We're just going to give you some more hand sanitizer. I'll get you to rub it in until all the alcohol has dried. Okay, you may now cross the line.